What's your name?
My name is Nicole Coliantes.
Okay, let's go. So, what's your career that you chose?
The career I chose was a certified nurse assistant, CNA for short, at a hospital.
So, what type of work do you do as a CNA in the hospital?
As CNA, I take vitals, and by vitals I mean like taking temperatures, blood pressures of the patients, taking their oxygen, how much oxygen they're taking in their body. If they need assistance with toileting, I take them. If they need assistance with walking, if they're weak after surgery, I assist them in walking so they don't fall. And anything else they need, they can just call me, and that's pretty much what we do.
It's good.
We assist the nurse.
It's great. What led you to choose this career?
Well, I'm in nursing school right now, and it's a good job to have if you're going into nursing because it helps you understand what you're getting yourself into. And so that's why I chose to be a certified nurse assistant before I actually become a nurse.
All right. So, where are you currently attending school?
I'm currently attending school in Chamberlain College of Nursing in Chicago.
So, what are you studying?
I'm studying nursing.
Um, what level of education do you need to be successful in your career?
I would say a bachelor's. I mean, although you can get a job with an associate in nursing, but nowadays in hospitals, if you do want to get a job in the hospital, they prefer that you have your bachelor's, and they might take you, but they'll want you to go back to school and try to get your bachelor's and while you're working as a nurse, or they'll make you promise that you will go back to school and get your bachelor's as a nurse.
Okay.
So I would definitely say bachelor's would be the best way to go than getting your associate.
Okay. Like, do you think you're extending your education more than you really need to?
Well, I'm not sure what your question is. I mean, I'm in nursing school. I think that helps definitely to be a better nurse assistant because if you're just if you just took the certified nurse assistant class, I mean, there's some things that you are doing that you don't understand why you're doing it, and if you're a nursing student, you understand why you're doing it, and it makes sense to you, and you do your job better because there's an explanation to why you're doing what you're doing.
Okay. What skills would you say are important for someone within your career?
Definitely, you have to be a good listener, um, have a good memory, um, very empathetic, just listen and be caring, and love what you do, and be willing to help people, even though it's not something that a lot of people wouldn't want to do. It definitely takes a special person to be a certified nurse assistant. Not just anyone can do it.
Okay. Um, how has your career changed, if at all, as new technologies have developed?
Well, before we used to use manual blood pressures, but now we use automatic blood pressures, which you just use a machine and you just put start, stop, and it'll just automatically just take your blood pressure for you. You don't have to use a stethoscope and listen to the patient's heartbeat or pulse, or no, the pressure of the arteries.
Would you say there's any negatives to the technologies that have been developed?
I would say it's not as accurate, I guess. It could, I mean, it depends on what kind of blood pressure or what kind of equipment you're using. Sometimes it could, you don't know unless you actually check yourself if something is accurate. Usually we don't usually check if the equipment is accurate or not unless there is a really big change in the patient's condition. So, yeah.
For people in your career field? Like, is it an area that is growing? Is it becoming more competitive?
I'm not sure if it's becoming more competitive, but it's definitely growing. I feel like, I don't know, because I've heard that nurses are actually doing a lot more of what the CNAs are supposed to be doing now because of like the government. I'm not really sure.
What advice would you give someone thinking about pursuing this career?
I would let them know that to be prepared. I mean, you need a lot of patience to be a certified nurse assistant. Some patients may not realize how much you're doing for them, and sometimes it's not the patient, it's the condition they're in that makes them like that. So you just definitely need patience to be in this career, and you just need to be a caring person towards people.
Someone or something inspire you to choose the career that you're in and studying right now?
I would say definitely my family. My family's been pushing me to become a nurse, and it's been good for them. I mean, it's gone well for them. Both my sisters are nurses, and they were CNAs before. My mom's a CNA, so yeah, it's taken them to good places, I guess. I mean, yeah, my family is a big part.
All right. Well, thank you for answering these questions. Good luck in your career.
All right, thank you. Bye.